I am a person, like maybe many of the individuals that are in this room, that are career people, career professionals and individuals. And tomorrow is Infant Loss Awareness Day, and I think that for many women that are family planning at a later stage in their career because they have put their career first, they're finding the process maybe not as quick as they thought it would be. For me, it took a little bit over a year for myself and my husband to conceive. We unfortunately had a miscarriage. The miscarriage was extremely painful. It wasn't easy. And I think that for many of us that are family planning, you know, at this later stage in life, we want to know what our options are. And our options are robust, and we have organizations like Kindbody that are really supporting us and are leading this movement for workforce change and also change in benefits for this new generation of women that are in the landscape. On a lighter note, you know, I dug up something pretty personal that, you know, just to lighten up the mood, you know, was a difficult journey, but I think that this particular video will showcase how I really felt about the entire journey. So, Shmali. Shafali, I don't know if I can hear you.
Can you hear the video?
I can't hear anything. Can you guys hear anything? All right, well, we're having some technical difficulties, but basically we can move on to the next slide. But basically, really what I wanted to message out is that whoever said in the movies that this was going to be easy, or that, you know, you have that stage where you're rushing to the hospital, that is never how it's like. So they lied. They lied to all of us. But in the spirit of all of the family planning folks in the room, I definitely worked on this with my baby girl, my toddler. So just before we get into the technicalities, I want to message out something, which is in the following slides. So I want to remind you, one, you're strong. There are many ways to have kids, many ways. So for me, because it was a difficult pregnancy and I thought I was going to go through IVF, and I might still go through it. I'm thinking about surrogacy, but I want you to know that there are many ways to have kids, whether it's adoption or surrogacy. And also, you're doing the right thing, right? You're getting your information, you are surrounding yourself with an amazing community, like the folks here at Kindbody that will give you that information, undoctored and robust, so that you can empower yourself. And then finally, I just want to tell you that you got this. It's extremely hard, and most of the most difficult things in our life are well worth it. And here she is, you know, after a year, after unfortunately miscarrying, you know, we're able to have her, but again, you know, we're planning on a surrogacy journey afterwards, and we're totally fine with that. So you got this. All the family planning in the house is here for you as far as supporting you. And with that, let's get to the meat of this particular presentation. So I want to introduce our speakers today. Dr. Fahima Sassan is a New York Times top doctor. So she was featured in the New York Times. She has been a practicing OBGYN and women's health expert for over 12 years. She's the founding physician of Kindbody. And her and her team have been focused on providing fertility support and serving women, paving the way for a new generation of women's healthcare. So I just want to say hello.
Hi, how are you?
I am so great. Thanks for being here with us. Okay.
I'm so excited to be here.
Yeah. All right. And then later on in the actual presentation, this is Taryn Branca. She's the vice president of Kindbody. She has over 15 years of experience in healthcare. She served as a partner at Mercer, as a director at Castle Like Health. She's actually going to be covering something really significant, I think, within the movement of workforce, which is what the competitive benefit landscape looks like for. So all of you leaders out there that are looking into change management, into this new generation of women and families that are planning their next stage of their career journey, right, know that there is diversity and inclusion efforts, right, with adoption and surrogacy, IVF, as well as egg freezing. So Taryn, I can't wait for you to start talking about that. But I'm going to remove the spotlight, and I'm actually going to hand that to the doctor, and she is going to review all the things and all the options. Fema?
Amazing. Thank you so much, Vicki, and thank you for sharing your personal journey. I'm sure I speak on behalf of all of us. It was touching to see the pictures of your baby, and I think it's at the end of the day, whether you are actively trying to conceive, if you've had miscarriages, if you've had loss, or you have plans of having a child someday, maybe even that someday is 10 years from now, I think that we, as women, as men, as the LGBTQ community, all of us have this universal desire for family building of some kind, and you know, the days where a family was 2.5 kids and a car and a two-door garage are obviously no longer the case, and there's a variety of families, and so I'm glad that you highlighted that. And so I'm the founding physician of Kindbody. My name is Dr. Fahima Hassan. I'm a board certified OBGYN, and I'm so excited to be here with you guys tonight. Kindbody is building a national network of women's health and fertility practices with a goal of ending the fragmentation that currently exists in our healthcare system. We bring together obstetricians, gynecologists, fertility specialists, nutritionists, therapists, with a unified goal that we as women deserve better care. We as women deserve more information, and we as women really need to have options so that we can have the families of our dreams, so that we can be empowered with the choice to be able to make the decisions that are right for us. And so we do that by coming to you in settings like this, and so that's why I'm delighted to be here with you. We have locations in New York, San Francisco, Santa Monica, Princeton, New Jersey, as well as very soon in Los Altos and in Century City and Los Angeles. We will also be opening in Seattle, Atlanta, and Austin, Texas within the next 6 months. And as we expand our footprint, we are not only going directly to women, men across the country, but we also go through employers as a fertility and family building benefit. And one of our focuses is that by adding fertility as a benefit through employers and by going directly to, you know, women like yourselves, we're one, increasing the information that's out there, but also increasing the access that you have to this care that's so vitally important. So delighted to be here with you guys over the course of the next, 30 to 45 minutes. I'm going to give you an introduction to fertility. And if we go on to the next slide, the reason why this is important is, unfortunately, we spend our entire lives, or most of our lives as women, trying desperately to not get pregnant. Right? Everyone knows what I'm talking about. And so then when the time comes, when we're ready to conceive, when we're ready to start thinking about our families, unfortunately, most of us don't know where to begin. Right? And where would we have gotten that knowledge, right? If you look at the scope of our education, we have sex education in middle school, maybe in high school. And again, the focus of that is not getting pregnant and avoiding STDs. And then even if you are a biology major or a science major, I would argue even if you are a physician, unfortunately, we really aren't taught the details of how is it that this reproductive journey occurs. And so then most of us are left blindsided as we are across the country seeing women are waiting longer to have children. Right? The days where our grandmothers and mothers had children in their 20s and early 30s are really a day of the past. Women are waiting longer to have children because we're aspiring higher education. We are aspiring higher calibers in our careers. We are waiting to meet the right partner. We are traveling, we're waiting for our finances, and sometimes it's all of the above. And as a result of women universally waiting longer to have children, our fertility issues are going to increase. So I am here as a founder to make right by that. We are here as a company to make right by that. And so I hope the next few minutes give you some information that I wish you had gotten a long time ago, but it's never too late to start. Next slide. So what should we know? When it comes to fertility, the most important factor is our age. It's not how young you look. It's not how young you feel. It's not about how much yoga you do or how vegan you are or all the fads that we try to do to make ourselves younger, prettier, and healthier. Not that I'm not advocating for those things, but it really does come down to our age. All right, so let's start at the beginning. The key thing to understand is that as women, we are born with all the eggs we'll ever have. We have about 2 million eggs at birth. By the time we reach our first period, this is very unfair, but by the time we reach our first period, we're already down to 300 to 400,000 eggs. I hope your jaws are dropping, but we lose the majority of our eggs just in that first decade or so of our lives. From there, every month, and this is regardless of whether you're on birth control, whether you actually had a period or not, regardless of menstrual bleeding habits, we lose up to 1,000 eggs a month. So if you're born with all the eggs you'll ever have, and you're losing this many eggs, as I just went over with you, inevitably, and this is the truth for all women, we all reach a point where we have 0 eggs. And having an understanding of when does that happen, where am I at in that journey? Do I still have a lot of eggs? Am I middle of the road? Am I low? Is fundamentally important, in my opinion, for women and for couples to know that, so that you make decisions that are backed with objective details, as opposed to what is our standard, which is our status quo, which is we kind of cross our fingers and hope for the best. I want to empower each and every one of you with this knowledge so that you can make decisions that are actually backed with your factual fertility knowledge. All right, so let's talk about age. So a lot of people know that there's some age at which your fertility declines. So all of us are kind of aware of that. But the unfortunate part is that we think that you're like perfect, and then you turn 35 and you somehow jump off a cliff. But the reality is that we are losing eggs gradually from birth, right? But 35 is an important age for us to keep in mind. And the reason for that is that 1 out of 10 women experience premature low ovarian reserve under the age of 35. So that's really important to understand. So yes, 35 is the age where the majority of women will have declined or lower egg counts. But we have to remember that there's 1 out of 10 women who under the age of 35 will experience that premature decline. And there's no way by looking at someone that a doctor could tell you. And unfortunately, we think that we go to the doctor, we get our pap smears done, I must be okay. But the reality of it is that there's no way from a pap smear or a regular gynecology visit you could know this information. So 2 things happen to us as we get older. Our egg count declines and our egg quality declines. What am I talking about in quality? Quality, I mean the 23 chromosomes that make up the DNA of an egg cell decline or deteriorate as we age. The same way our skin doesn't look the same from the day we were born or 5 years ago. Our hair changes, we get wrinkles. All of those things are a result of our cells aging. Our egg cells age as well. So 2 things to keep in mind. As we age, our egg count decreases and our egg quality decreases as well. So what's the take home? You're never too young or too old to learn more about your fertility, to learn more about your egg count, to learn more about your ovarian reserve, because the sooner you find out the information, the more proactive you can be, and typically the more options you will have. All right, so just talk to you about all this stuff declining and how important it is to be empowered with the information. So how do we get this information, right? So we can do that with a fertility assessment. And this is something we would do in a typical appointment for you at Kindbody. So first you would come in and do a one-on-one consultation. That consultation can either be virtually or in our clinic. And it's always performed by a physician, healthcare provider. So you're not like going to to some sort of administrative person, and that one-on-one consultation is to go over your medical history, to go over your surgical history, what medications do you take, what are your menstrual cycles like, how old was your mom when she stopped getting her periods or went through menopause, what are your life goals, are you in a relationship, are you single, how many kids do you want to have. So we really go through all the layers of the onion to really understand where you are at your life medically, but also where are you in your life as far as your trajectory, your family planning goals. Second portion, if you're in the clinic, this all happens on the same day. If it's virtual, we would coordinate for you to come in, is an ultrasound. This is a vaginal ultrasound that allows us to actually look at the follicles or eggs within your ovaries, which is one of the components of checking your egg count. And then the second part is doing a blood test called anti-Müllerian hormone, which gives us an estimation of how many eggs do you have left from that 2 million you were born with. So the combination of the ultrasound and the blood test allow me to objectively tell you, hey, Sally, based on your age, based on your sonogram, based on your blood work, this is how fertile you are. So then together we can make a decision as partners in this journey, what are the right choices for you to do to maximize your fertility potential. And on the right here, at Kindbody, we're really tech enabled. We really focus a lot on technology, and we have our own proprietary electronic medical record and portal where we don't just release your results to you like a traditional doctor's office where you get it kind of in like this plain text and you're not quite sure what it means. But when you get your AMH level and your follicle count, it'll come with really nice descriptions of what these numbers actually mean and how they relate to you. And we'll use that technology combined with warm touch of your doctor to better understand your results. All right. So then once you have your results, depending on where you are in your life's journey, we can help you understand what your options are, what would work best for you. That option may be to freeze eggs if you're a single woman, or that option could be to freeze embryos if you have a committed partner that you're ready to kind of take that next step with. Or if you've been having trouble conceiving, then it may be that you need a fertility treatment in the form of intrauterine insemination or in vitro fertilization to help you conceive. One really important point in this is understanding some people think that if you're having problems getting pregnant, the only solution is IVF. And what I want to share with you is that there is never going to be one size fits all. And then we're going to work with you on a one-on-one basis in an individualized manner to ensure that we're taking the path that works for you as a couple, that works for you as a person. So whether you're a single mom choosing to have a baby on your own, whether we're using donor sperm in a same-sex female couple, or you are in a heterosexual relationship and having difficulty conceiving and IVF is the route you need to take, we're here to go over all the options, go over all the success rates, go over all of the potential, and then see what works best for you. Yeah. All right. So let's start off with what is egg freezing. So egg freezing is, the best way I can tell you is, I mentioned to you that this is all about age, and as we age, we lose eggs, right? So egg freezing is a way of basically pressing pause. I can't make you younger, right? We can't change our age, but we can press pause and reduce the number of eggs that we lose. So I always like to use in explaining egg freezing this tissue box analogy. Imagine this tissue box represents your ovaries. We have two ovaries, our right and left ovary, and within our ovaries at any given moment in time are all the eggs that we'll ever have. So you're born with a full tissue box, and right this moment you have however many you'll ever have. When we do that AMH level, remember that blood test I was telling you guys about? It's like understanding, it's like almost like a gas gauge. It's understanding how many eggs are in my tissue box, or how many tissues do I have. So the AMH level is a score that gives us an idea of your total egg count. And then what happens is each month our body recruits a group of eggs. This is the follicle count, so that we can see how many eggs is your body recruiting in a given month. Okay, so we combine the AMH level, the blood test, with the ultrasound information to know your total egg count. And then what naturally occurs is our brain sends a signal to this group of eggs that were recruited that month to help one egg, one solitary egg, fully mature. This one fully mature egg is the only egg that has the capacity to become a baby. Okay? But if you're not trying to conceive or you're using contraception or whatever, or you're not getting pregnant, this one mature egg is lost. This whole group of eggs are lost forever. And then following month, your body goes back to your tissue box and recruits a new set of eggs. And through this process, we lose eggs until our ovaries become empty or our egg count goes to 0. So what we say with egg freezing is, all right, I know that only a mature egg has the capacity of becoming a baby. And I know I have a group of eggs that I'm going to lose in the next 30 days. So what we do with egg freezing is we give you the same hormone that your body naturally releases to make this happen, but we give it to you at a higher dose to help the whole group of eggs mature together so that once they're mature, because only mature eggs can become babies, we can extract it and save it for you to use in the future. So all we're doing with egg freezing is helping a group of your eggs that you would otherwise lose mature together. We're not making new eggs, we're not making more eggs, and maybe most importantly, we're not stealing from your fertility. We're taking eggs that would otherwise be lost anyway for you to use in the future or never use. So what should you consider when you think about this egg freezing process? A couple of questions, and if you have a partner, I advise you to do these questions alone and then come back to your partner and see if your answers match. Number 1, how old are you? We're amongst friends here. Be honest. Number 2, how many kids are in your ideal family? And again, be honest. Maybe it's 0, that's okay. Or maybe it's 3 or 4 or whatever it is, but how many kids are in your ideal family? The third question is, how old will you realistically be when you have your first child? And then maybe equally important or more important, how old will you realistically be when you have your last child, especially if you want to have more than one? And the key reason to understand this is that it's not like we get pregnant and the next day we have our second baby. Pregnancy itself is almost a year, 10 months, 40 weeks. And the medical recommendation is to wait 1 year from the birth of a child to the start of the next pregnancy in order to prevent preterm labor and preterm delivery. So as you think about the kids you want to have, you have to put at the bare minimum a 2-year space between your kids. So if you start doing this math or answering these questions honestly, and you start seeing you're going to have some or all of your kids over the age of 35, or you're not sure when you're going to have these kids, then egg freezing is something you should strongly consider. All right. So how does the process work? I hope my tissue box analogy helps make what is typically a hard to explain concept a little bit easier. And so we kind of already went through this, so we can go on to the next slide. And so the big thing to understand is that, again, we're being opportunistic. So a lot of people will say, oh, I don't want to freeze my eggs because I feel like that'll make it harder for me to get pregnant in the future. And that's definitely not what's going to happen. And then some of the other concerns people have are, I don't want to use hormones. I don't want to subject myself to something, external, or I don't normally do well when I'm on birth control pills, so I'm concerned about doing egg freezing. And the key thing to understand is that the hormones we're using in egg freezing are the same hormones your body is naturally seeing every month, just at a slightly higher dose. And these medications are not associated with significant mood changes. And in fact, the most common side effects are bloating and feeling a little more tired than usual, but you would still be just as functional as you normally would be. Next slide. All right, so this gives you a schematic of what I was talking about. So the whole process of egg freezing typically takes about 10 to 14 days. You're giving yourself hormone injections typically for about 10 days. So in this calendar, that yellow dot would represent the start of a woman's period. She would start her cycle about 2 days later. And the maximum amount of time this entire process I just explained to you would take is about 14 days. That's all. So that's often another misconception, is that this process is months-long ordeal, but one cycle maximum only takes about 14 days. And what you're doing is you're coming to our office about every other day. And why do we need you to do that? Because remember, we're watching a group of your eggs mature. So we need to monitor them closely so we know exactly when to extract the eggs. Because if we extract them too early, they're not mature, they're useless. And if we wait too long past maturity, they'll be lost. So that's where the monitoring comes in. And at Kindbody, we're really respectful of your time. So when you come in for appointments, we're making sure you're coming in and out relatively quickly, so you can come, do your sonogram, do your blood work, and get back to work. I know nowadays that means go back home to do work, but still. And the injections, I know, are a common point of fear for a lot of women. I understand that, but we teach you how to do it. We have amazing nurses and videos that you can watch at home. And we'll even take it up a notch if you need. We'll FaceTime you during those injections at night so that you have, you will always have a partner in this process with you. And in the event that those injections are really taking you into another universe, we can even coordinate for one of our nurses to come to your home and administer those medications, or teach a friend to give you the injections. So I just don't want anyone to not do this for fear of the injections. It's definitely something we can help you power through. All right, the retrieval. So let's say now you did the injections for about 10 nights. We've monitored you closely. We recognize your eggs are now mature and it's time to extract them. The actual retrieval is just a 10 to 15 minute procedure. It's done under a sedation or a twilight sleep. So not general anesthesia with like a tube down your throat, just a twilight sleep so you have no pain. There's no stitches, no bandages. It's not a surgery, but really a very simple procedure done with a small needle passed through the vagina. That day, someone would need to take you home because you were under anesthetic, but the very next day you can go back to your normal activities. So really doesn't have to be like a 2-week hiatus from work or life, but just one day that would be required to take off. All right. What comes next? Your eggs are then stored in our facility for as long as you need. You know, my personal hope for any woman who freezes your eggs is I hope you freeze your eggs and you never need them. I hope that you're subsequently able to conceive naturally with your partner, with sex at home for free. But in the event that life has another plan in store for you, then and you're at the time where you're ready to have your child, again, whether that's your first child or your last child, and you're not able to conceive naturally, then you would come back. We would thaw the eggs that we froze, fertilize them with your future partner, boyfriend, husband, sperm donor's sperm, create an embryo. We can then genetically test that embryo to ensure that it's normal, and then put an embryo back in your uterus to grow. So that would be the completion of the process, and hopefully end up being a successful pregnancy. So briefly, we'll touch on IVF. So the only difference between a woman going through IVF and a woman going through egg freezing is the woman who's doing egg freezing has chosen to stop at the point where the eggs are retrieved from her body, and she's freezing her eggs to use later. The woman going through IVF is doing the exact same calendar I showed you, the exact same process, the exact same hormones, but she wants to be pregnant now. So on the day those eggs are retrieved, instead of freezing them, they're fertilized with sperm, an embryo is created, and that embryo then a few weeks later is transferred into her uterus to grow. So again, the only difference between egg freezing and IVF is when is it that you want to be pregnant? Do you want to be pregnant now? Do you want to be pregnant in 10 years? The other parts of the process are exactly the same. All right. So now we talked about egg freezing, briefly touched on IVF, but what does it really mean to be infertile, right? What are the definitions? So I'll give you the standard definitions. Standard definition is if you are a woman over the age of 35, then you are officially considered infertile if you have been trying to conceive for 6 months and you have not gotten pregnant. And trying doesn't mean you were mentally prepared. Trying just means you're having unprotected sex where a man is ejaculating in the vagina. It doesn't mean you were doing ovulation kits. It doesn't mean you were somehow focused on it. It just means you were having unprotected sex and did not achieve a pregnancy. And women under the age of 35, it's the same thing, except it's with 1 year of trying to conceive. All right, so those are the definitions. And then maybe the sad portion of this, and the reason why I'm so excited to be talking to you guys about this, is the reality of it is that infertility is common. 1 out of 8 couples experience infertility. It's not rare, right? And 1 out of 3 couples, and this might, you guys might find interesting, the fertility issues actually related to the man. So when you come to Kindbody, if you have a male partner, we strongly advise you, whether you're ready to have a baby or not, that he also have a semen analysis, right? Because we often, as women, take the burden of fertility issues solely upon ourselves. But we have to remember that it does take egg and sperm to create a baby. And so having the man assessed is also really important. And then the last thing, which I'm extremely passionate about, is that I don't want any woman or couple to wait till they have an infertility diagnosis to be evaluated. My hope is that you come and get checked out and make sure things are good before you start trying, before we waste 6 months, before we waste a year, and in some sad cases, before you've wasted many years. Let's come, let's be evaluated, let's make sure things are good before we start trying so that we can start our journey, with all our boxes checked and security that we're good. And if you happen to find out something's wrong, we can address it sooner. Because at the end of the day, time is not on our side when it comes to fertility. All right. So paths to parenthood, and I loved Vicky's slide where it said there's more than one way to make a unicorn. I love that. I'm going to steal that. But paths to parenthood, natural conception, sure. But there's other treatment options, right? Intrauterine insemination with either your partner's sperm or donor sperm can help couples who've been having difficulty conceiving, or let's say we find out that you don't ovulate every month or you do have PCOS, that can be really helpful. In vitro fertilization, either with your own egg or donor egg, if you happen to have a poor egg count. Even just helping you ovulate and telling you when to have sex at home, which is called timed intercourse. And then, of course, other family building options, using an egg donor, using a sperm donor, having a gestational carrier or surrogate if there's something that's preventing you from being able to carry a pregnancy. The bottom line is that there's many paths, and we want to help you explore those options. All right, so what's your next step? I started with this, I'll end with this. Whether you are actively trying to conceive, whether you've had miscarriages, whether you've had those horrific losses, or whether you are perfectly happy and you're actively trying to not get pregnant right now, but you aspire to potentially have a child in the future, I think the most important thing is for us to learn as much as we can about our bodies, to learn about our ovarian reserve, to check out our fertility so that we stand educated and then we make the decision to wait, or we make the decision to act based on knowledge and not based on Dr. Google or based on fears, and objectively based on facts. All right. No discussion about fertility would be complete unless we talked about the big elephant in the room, which is, yes, this can be expensive. And one of our missions at Kindbody is to really help reduce the cost. I think that fertility care and reproductive care is a fundamental right to everyone, not just the top 1%, not just people who have a lot of money. And so we do want to improve access to that. So for those of you who, if you don't have insurance or you're self-pay, the prices are there for you. So we're giving $100 off to attend to have a fertility assessment, which would include the consultation, the ultrasound, and having your hormone tested. If you'd like to proceed with an egg freezing cycle, we're also giving you $1,000 off for that. So it'd be $5,500 for an egg freezing cycle. And then with an IVF cycle, again, we're giving you $1,000 off. So it's $11,500. Just for clarity, the egg freezing and IVF prices do not include the cost of medication, but we can help you provide full transparency on those prices on a one-on-one basis. If you have insurance, we do accept all the major insurances at Kindbody, so you can come and see us both for your routine gynecologic care, because we do the full spectrum of women's health care, as well as for fertility care. And depending on the fertility treatment that you need, we can help you, let you know if it's covered by your insurance, and help you understand all of those nuances, because everybody knows dealing with insurance and finding out what you actually have, what kind of coverage you have, can be a monumental task. So we do try to take that stress off of you. So I encourage all of you guys to make an appointment. Let's learn about your fertility. When you can go to our website directly, kindbody.com, and make an appointment directly through our amazing tech-enabled portal. You don't have to call or be on hold. And then just put the mBolden code in the promo code section, and that'll give you the special pricing. And we'll have that in our system, so you don't have to remind us if even, later you decide to proceed with treatment. We'll already honor those specials that I told you about today. All right, I think I'm passing it on to one of my favorite people, Taryn, and then I'm going to be here at the end of the talk to answer any questions that you guys have, but I'll hand it over to Taryn.
Oh, good, thank you. And there are a lot of good questions, Fahima, for you to take a look at. I do just want to share, that was such a great overview, and every journey is really so unique, and I think it's just so important for everyone to understand that nothing's right or wrong. Like, this is really your own personal journey. We all have our stories. I actually successfully on my own had, with my husband, had my first 2 boys, and then, chasing around 2 boys and building my career, I was tired. And so waited a little too long to have our 3rd. And, we felt like someone was missing. And I felt really guilty having people around me that were struggling to have their first and having miscarriages, and felt really guilty about wanting to have a 3rd, and finally decided to go through IVF, and had just one embryo that made it through the genetic testing, and that's my daughter, Amalia. So I will tell you, I wish I had Kindbody. I saw a question come through about injections, and I remember having to give myself my first injection, and I was terrified. You don't feel it, I will tell you, which is just, it's really our minds that we have to get really comfortable. But that's a big part of the reason why I'm here at Kindbody and joined the team earlier this year, to really work with employers, to educate them about a lot of what you've heard tonight. We do a lot of sharing around just educating infertility, but also to share our solution, for a benefit solution that we have for employers. And so I want to, ask each of you to really be an advocate for yourselves, be an advocate for your friends, your colleagues, and get educated around, what your benefits might look like. We know that, employees feel much more positive about their employer if there are fertility benefits in place. And that really extends now beyond just fertility care, but really adoption, surrogacy, and donor services as well, to really create equity in benefits and be able to let anyone that chooses to have a family, excuse me. These are just a few logos here of some of our clients. We're growing really rapidly, which is really exciting. And really the goal is, again, just to, as Fahima said, just to provide more opportunity and more support for all of us to be able to take our family building journey and take the path to parenthood. So what does it mean to have a fertility benefit? As Fahima just shared, it's really hard to understand this. So I will tell you guys, the best thing to do is really to ask at your employer, ask your benefit leader. So the person who maybe onboarded you or gave you information before you started, ask the specific questions. What does the coverage look like? What does it actually cover? Get into the weeds with the data that you just heard and learned about. Look for things like cycle coverage, IVF coverage, egg freezing coverage, and don't be shy about asking. And as Dr. Sasan said, it's really important to know this sooner than later, ideally before you need it. We are working with all of the major carriers, all the major health plans, and we are seeing that more and more employers, especially those in the tech space, are offering or even enhancing their benefit So Kindbody is really a very easy addition to any current medical plan that employers have. It's really easy to add us in and turn us on. And we have the ability to really customize that for employers. You know, we know that, you know, we're in a global pandemic. There's a lot of budget restraints and a lot of challenges, but I will tell you, a lot of employers are adding or enhancing this benefit right now. They see and understand the value that this means to their employees. And so they are focused on really enhancing this benefit for their employees. We have mobile care that we can bring. We have a mobile van, which I know Dr. Sasan has been part of in the past, and we hope to get back out again soon. We have the ability to work with COVID protocols to be able to get back out. But we have lots of virtual services. As Dr. Sasan said, we can do virtual assessments. So we really just, our goal is to make it really easy for our members. And we have dedicated care navigators, dedicated patient care support, concierge support for our members. Employers really do, when they add or enhance a benefit like this, they want it to be a really great experience for you all. And so our goal is really to help make it as easy and as high touch as possible. So how do you talk to your employer about adding a fertility benefit? So as I said, I think it's really important to ask this question and really understand what's in place today. Our clients, and even many prospective clients that we speak to, tell us that it's so valuable for them to hear from their employees and know what's important. I'm sure many of you have received surveys from your HR team or for your benefits team. Speak up if this is not in place. And really make sure it's on their radar. I will tell you, just one voice can really create change within an employer. We've seen it happen. We have a lot of clients that are the result of one employee raising their hand and saying, like, we need to add this benefit or we need to enhance this benefit to really make it equitable to anyone that is looking to build a family. I will just say too that there's some stats here that I think help support what Dr. Sasan shared with all of you. We know it gets harder as we get older, and we know that there are many of us are waiting, are building our careers, are choosing to wait to have our families, and thankfully we have great options to help us successfully build our families. But these are just some stats for you to be able to share with your benefits team so that they understand time is the big factor. We want to be able to offer this benefit sooner than later to really empower you all, empower employees to be able to build their families successfully in the timeline that fits for you all and fits for your family. We know that, you know, there's lots of people out there that are struggling at any age. And so it really is important to share this information with your employer, make sure that they understand that this is important to you and likely important to many of your colleagues. So last, I think we all, I think, could share stories about things that have been added to our benefits or different perks that have been added at our employer. It's the reason why a lot of people make changes in their careers. It's the reason why a lot of people stay where they are. Benefits are a big part of our kind of total rewards package when we think about choosing to stay or choosing to move to a new employer. And we know that a lot of folks are going to choose to stay or to go based on the benefits. And the fertility and family building piece is growing just exponentially right now in the market, and more people are really looking for this and asking this question when they're going through an interview process and looking to make a change. So we know that this benefit can really create a happier, a more productive workforce. We know that it takes a lot of the pressure off, not only financially, but also emotionally, to know that you have a partner with someone like Kindbody to really help guide you, and having a physician like Dr. Sasan, our other physicians and clinical staff, just really there to hold your hand. As I said, I wish I had them 5 years ago when I went through this journey. I'm so grateful to be here now and be able to hopefully help many of you have the opportunity to work with Kindbody in the future. So I know there's been questions coming in. So Dr. Sasan, are there any you'd like to answer?
Sure. Rebecca, are you bundling them or someone bundling them? I'll be happy to answer.
We're bundling them. So I have actually quite a few that were grouped together. One of them is, can you talk about the success percentage of age for IVF for women over 35. So folks are wondering what the success rate is.
Yeah, the success rates are not generalizable. It's really going to depend on your age, so your exact age, because 35 is different than 39, and even 37 is different than 38. Two is your egg count. So without knowing your follicle count, which is that important ultrasound information, and without knowing your anti-Müllerian hormone, which is that blood test, there's no way to tell you, and no generalization in the world is worth it, because as I mentioned earlier, unfortunately, 20% of women under the age of 35 will end up having fertility issues and have a hard time getting pregnant. So if that's the case for 20% of people under 35, I can't even start by giving a generalization for people over 35. We really need some facts before we can tell you. And then really cool part, again, I'm excited to be talking to a techie team or audience, but we actually have a really great app or really great calculator within our portal, and app that you can use where you can actually then plug in your data, your age and your follicle count and your hormone levels, and it'll tell you what is my personal success based on this data of having a successful pregnancy. And we'll help you figure all that out once you do your assessment.
Wow, very cool. So is that app publicly accessible so anybody can download the app, or do you have to get
or
onboarded?
you can even just go to kindbody.com and you can do it through our portal too. So you don't even have to worry about downloading an app. But the key is that you do need the assessment information, which is the ultrasound and the blood test, to be able to fully, for anyone to be able to fully give you an answer.
Mm-hmm, mm-hmm. Okay, so I'm actually gonna, we have a bunch of questions coming in, so I'm gonna go kind of like
sure, rapid fire. Yeah,
rapid fire. So Taryn, for the benefit side, I mean, even for me, so with people who are leadership at their company, can you talk about the implementation of these sorts of benefits and how it financially impacts, like, for example, smaller companies that have smaller budgets? What would that rollout look like versus I'm in a large enterprise company, or I'm mid-size? What is tacking on a benefit like that cost of the employer and all that? Could you possibly talk about that?
Sure. So I'll just tell you that there are two different kinds of ways that an employer gets insured, fully insured versus self-insured. It's way more detailed than any of you that aren't in the benefits or HR space need to know, but those that are will understand. For a fully insured, which is usually a smaller organization, it's very easy to wrap Kindbody around any existing coverage or to fill in some of the gaps. Typically, some states have mandates, and so you'll see IVF coverage, but you may not see egg freezing, embryo freezing. You may not see adoption, surrogacy, or donor services. So typically what we do is just assess what's in place today, and then plan and give some ideas on how to enhance the benefit and really make it a more inclusive benefit. The pricing is really very simple. We have, as Dr. Sasana shared, we have a very straightforward pricing model. It's much less expensive, about 30% less expensive than if your employer put in a health plan or another vendor, another fertility vendor out in the market. And so and that's because we're in the provision of care. We have the ability to really manage costs in a much different way because we are the provider. And so, what we do for any employer is really put together a financial model and analysis to be able to show them what the costs look like. And I think also just what's really important is we have the ability to really customize what the plan will look like. So if, for example, an employer is adding this benefit for the first time, we have some creative ways and kind of first step ideas around plan design to make the budget a little bit more friendly. And then typically we see as they get to year 2 and year 3, they enhance the benefit because of the great response that employees have. And the reality is this is not a very highly utilized benefit. We see about 1.4% of an employee population utilize this benefit, but it is a very, very high cost benefit. And if not managed properly, it can result in high NICU costs, high multiple rates. And so that's where the strength of our clinical team, Dr. Sasan, all of our clinicians, help to make sure that we're really taking care of the member and making sure that the outcome is a healthy live birth, and really focusing on some protocols like single embryo transfer, for example, now that we have based on genetic testing and advances in technology. So, and we'd be happy, and I'm happy to speak with anyone. If there's any questions or any specific questions, feel free to message me directly as well.
Thank you. Thank you, Taryn. Dr. Sasan, this is a popular question. Folks are wondering what age is too old to freeze their eggs? Is there a cap on that?
Sure. So the cap is 43. So if you are 43 and older, we do not recommend egg freezing, because at that point the quality of the eggs are going to be poor, and there's no benefit. Maybe a better question is, what's the best age to freeze your eggs? And that answer would be however old you are today, because I can't make you younger, right? And so however old you are today is the best your eggs personally will ever be. So if you're 28, amazing. There are probably going to be a lot of them, and they're going to be really good quality. But even if you're 38 or 39, your 38 and 39-year-old eggs are better than your 40-year-old eggs will be, and so on and so forth. So that's where I go back to my initial response. You're never too young or too old to look at your options. And if you're interested in egg freezing, however old you are today is the day to do it, because your eggs will never get better.
Yeah. Well, so, I mean, again, I wish I had known this. You know, as I was planning, I was like, okay, I'm just going to have kids in my mid 30s. I'm going to work on my career first, do all the things. So for all of you younger ladies out there that want to freeze your eggs and are thinking about it, don't wait. Listen to the doctor. Okay, Dr. Sasan, a follow-up question is about men and kind of their process involved in that. First of all, what you address this, right? Male fertility plays a role, but does this organization offer male fertility assessments? What does that look like? Do you work with sperm donors? Maybe kind of color in a little bit more. Folks are curious about that in the audience.
Absolutely. So as part of being really focused on providing comprehensive care, we do the male evaluation as well. The male evaluation is much simpler, so I needed a whole 45-minute presentation to tell you about the female evaluation. The male evaluation is a semen analysis, and yes, we do those. The semen analysis allows us to look at sperm count, sperm concentration, the motility, which is how the sperm swim. We want to know, do they swim round an aimless circle, or do they swim straight, which is what they're supposed to do, and then the shape of the sperm. So those are all the values that we get from a semen analysis. The only other parts that a man would do is, for example, if you're going to do genetic carrier screening, which we do recommend as a couple. So genetic carrier screening is to see if a man and woman are carriers for any of the same genetic diseases. And in the event that they're a perfect match, there would be a chance of passing it on. So if you have a male partner, we would test him based on what diseases you as a woman are a carrier for. And that would just involve a simple blood test. So we do those in-house. So we come to our San Francisco clinic, we provide semen analysis there, and we encourage you to have your partner tested simultaneously with your own testing so that you can both be equally empowered. We do work with sperm donor agencies. There are a few that we recommend just based on their caliber of the testing that they do for their donors, and they also do genetic screening, which we know is important. One of them that we like is California Cryobank, which actually is a national company. It's just the name. Fairfax is also a really good one. So those are the two that we highly recommend, and we can help you work out the nuances of how you do that. But we definitely do work with sperm donors. Main thing is, if you have a partner, have them do a semen analysis. Whether or not you're ready to have kids now, it's just a good opportunity to have him tested.
Okay, so first of all, we have a lot of questions rolling in. We are going to go past the 4 o'clock hour just to, make sure that we have as many questions answered as possible. So I just want to be mindful that we had over 130 people out here in the community join us today, and so I definitely want to address everybody's questions. Erin, first of all, thank you for your question. She is asking if I froze my eggs at 35, but I'm now 38 and still haven't tried to have kids, but want them. Would it be smart to do a second round of egg freezing?
Yeah, I would make that. Remember my 4 questions I told you? How many children do you want to have, and how old will you be at the age you have your first? So I would base my answer on based on how many eggs you have that are frozen. We need about 10 eggs for the improved chance of 1 baby. So if you already have, I don't know, 20, 30 eggs frozen, then you're probably good. If you only have a few, then it would make sense to freeze more. So yeah, I would have to just know exactly how many eggs she froze in that first cycle to better be able to give you the explanation. But the general rule of thumb is you need about 10 eggs for the improved chance of 1 baby. So do the math based on how many kids you want to have.
Gotcha. Okay, Taryn, can you talk about traditional healthcare plans and you were saying evolving, you're right, like making sure that it's more inclusive. Can you talk about that a little bit more? What does traditional healthcare plans look like, and where's the wave going?
Sure.
Why, right? What is surrogacy? What is that stuff?
Sure. So traditional health plans will have basically that early diagnosis. Sometimes it'll cover an assessment and sometimes some of the medications, but it's very, very limited. And we've seen over the last probably 5+ years, this increase in really the need for the benefit, as many of us are choosing to wait a little bit longer to have children. And so where the market really has shifted is really looking at cycle coverage, so IVF coverage, egg freezing, embryo freezing coverage. IUI has been something that's been part of some of the more traditional health plans. It's a little bit less expensive, but it does have a high result in multiples. And so, our goal at Kindbody is really to, as Dr. Sasana shared, really assess the patient and provide guidance and provide support to really get the member to the fastest, safest path to live birth. And sometimes that might just, as we all know, might just be a little teaching that we all need since we don't learn this early on. The market really is moving towards, I'm on conversations every day, multiple times a day with employers that are really looking to create diversity, inclusion, and equity in their benefits. And that is across the board. That started more on the pay equity side. We saw a lot of focus on pay equity across genders a couple of years back, and that's shifted now over the last couple of years to benefits. And so when you think about equity and benefits and you drill down in fertility, if you're only offering coverage for IVF, if you're not offering donor services or surrogacy services or adoption services, you've cut out a large percentage of your population that's in the LGBTQ+ community. And so employers really are taking a step back and looking at the coverage that they have, the support they have for members to help guide them through this journey, and really making sure that there's equity. So, we do offer services to support adoption and donor services. Donors could be needed for egg, for sperm donors. Surrogacy is having another female could carry the embryo for you. Very interestingly, surrogacy was actually illegal in New York on the East Coast just until earlier this year. And so it's really fascinating how the movement really is continuing to grow and just really continuing to support all of us that are really looking to build our families in the way that we choose.
Yeah, thanks. I want to thank you so much for that. I want to be mindful of everybody's time. And so I'm going to ask maybe one more question and then I'm going to wrap up. How much of IVF, this is for Dr. Hassan, is done in clinic at home? So folks are asking.
I'm sorry, you cut out for a second. How much of it is done where?
In clinic versus at home. Yeah.
Okay, sure. So if we go back to, I don't know, whoever has the slides, if you can go back to that calendar, or you don't even have to. So remember I mentioned to you egg freezing and IVF are both start at the same place. So if you look at this calendar, the first portion of IVF is to retrieve the eggs, right? And that process takes a maximum of 2 weeks. And I know it's small print, but if you see those little black circles on Friday and that following Monday and Wednesday and Friday and that following Monday, those are when you're coming to the office. So there's about 4 or 5 times over a 2-week period where you come for a 15 to 20 minute office visit. The retrieval itself is the day that's done under sedation. That you're coming to our office typically for about 2 hours total, 30 minutes before your procedure just to get settled in. The procedure itself only takes 10 to 15 minutes, and we usually watch you for about an hour after because you were under a twilight sleep, not because of the procedure itself. Then you're home waiting for our incredible embryologists who I'm fascinated by every day, who are going to be taking those eggs and fertilizing them with sperm and creating embryos and genetically testing your embryos. And so then you're kind of doing a little bit of a waiting game. We're going to keep you updates every day. How are your eggs growing? What fertilized? What created an embryo? And then if you do genetic testing, it takes 2 weeks actually for the genetic results to come back. So at that point, you're just patiently, or maybe oftentimes not so patiently, waiting. And then once we get back your genetics results, we'll then make a plan with you as to when we're going to transfer the embryo in your uterus. And sometimes that can be just that following month, immediately. And some couples will say, we want to wait to do the transfer, after the holidays or whatever the case may be. So that's something we would work with you on a one-on-one basis. Short answer, you're coming to our office, including your initial assessment, maybe about 7 times total. That includes all the cycling visits and the retrieval, and then coming back to have the embryo implanted. So it may sound like 7 is a lot, but when you think about what you're accomplishing during those 7 visits, it's actually not that much.
Yeah. Okay, so I'm going to wrap up, and I just want to acknowledge the speakers. Do y'all have anything that you'd like to kind of burning share before we close and wrap up on some speaking issues?
Yeah, I think my take home to all of you guys is, listen, obviously as being part of this mBolden community, you have all made huge investments in your careers and in your education. And, I applaud all of you for where you are as being a part of this organization. And I think that if we just step back for a moment and think about how we focus so much of our lives on being proactive and on being preventative, right? We all try to eat well. We hopefully don't smoke anymore. We exercise. We do all of these things to be the healthiest version of ourselves. And those are all because we want to be preventative. But when it comes to this thing that means so much to us, which is having a family, we kind of just leave it to luck. And I really want to bring the conversation back to, let's not leave our reproductive health and our fertility to luck, and let's really try to be as preventative as possible. Let's be as proactive as possible. And I know this conversation is scary, but it doesn't have to be. And if you just take away that first Band-Aid and peel it off and come and just do the assessment and know that we'll be your partners through the journey, it can be much easier, and in the long run, even if you don't get great news, it can be empowering.
Thank you, Dr. Sasan. Taryn, do you have any closing remarks before I wrap up?
Yes, and thank you so much. This has been such a great conversation. I would just say every journey is unique, and be proud of your journey, and speak up and advocate for yourself and for your fellow colleagues with your employer. And I think it's so important for us to take a more proactive approach. Dr. Sasan is so spot on, really educating ourselves, not only about our fertility, but educating ourselves and what our benefits look like, so that we have access to information and can make really smart decisions based on that information.
Thank you, Taryn. Well said. So I just want to mention a couple things before we formally wrap up. Thank you again to the over 130 soon-to-be parents that have joined us. Remember, in many ways to have a baby unicorn. I want to mention that we're going to be sending out emails to everybody that attended with the mBolden discount code, a link to the recording, and a link to submit a request for us to talk to your HR department about any sort of fertility benefits. That the Kindbody team will help you with that. And also, if you want any more details, please visit kindbody.com. If you want to join the 2,000 member, 10,000 member globally Silicon Valley Women in Tech community, please go to wearembolden.com. And if we didn't answer everybody's questions, you can drop us a line at navigator@kindbody.com, navigator@kindbody.com. So the Kindbody team will get back to you with any of your questions. But other than that, I just want to say, first of all, shout out to Brooklyn and New York. I see you. I'm in the Bay Area, but I'm from there. So, you know, I see you guys from Philly, from all over. Everybody joined us from different parts of the country. Thank you for joining us. You all are the future, and you're the new wave, and women are doing it, and we're doing it together, and we're helping each other. So with that, thank you so much to our speakers. Y'all, thank you so much for your information, and we'll see you next time. Bye, everyone.
Bye.